I'm Alex. I'm going to be demonstrating a barium enema. So, you need a towel, some gloves, some lubricant for the enema tip, a gown for your patient, an air infuser, a balloon inflator, the actual enema tip itself, the bag, some tape, and the barium. You definitely want to make sure that the bag is no more than 24 inches above, and you're going to mix about 500 milliliters of barium with room temperature water so it's more comfortable for the patient. Oh yeah, and you also need hemostats as well. Yeah, then you're ready. How are you today? My name is Alex. I'll be your technologist. So can I have you please change into this gown and take everything off, and the opening goes into the back, okay? Alright, perfect. So, what is your first and last name?
Betty Smith,
And date of birth, please?
5/5/1920.
Okay, is there any chance of pregnant?
No.
Okay, and why are you having this barium enema done today?
My doctor said I had to.
Okay, got it. So did you complete the pre-procedure instructions?
Yeah, I drank that stuff all day yesterday.
Okay, and so you only had clear liquids, and you haven't eaten for at least 12 hours, and you performed the cleansing enema, correct? Okay, and you also had a laxative you had to do. Okay, perfect. Okay, so the first thing that I would do for the barium enema exam is to take a scout image. For this image, you are making sure that the colon is properly empty from the pre-procedure things that we ask the patient to do. The central ray is going to be 2 inches above the iliac crest, so just a little bit higher than a KUB. And then from there, I'm going to have my patient lay down on the table. Oh, 85 kVp at 20 mass would be a proper technique for the scout image, especially on a small patient like I have. So then from here, I'm going to have her turn onto her left side, please. And then you're going to put one leg in front of the other just like this and kind of be at an angle. And then this is called the Sims position. She's in a 35 to 40 degree oblique position. So as you can see, the IV pole is no more than 24 inches above where the level of the rectum. I'm gonna ask her to take deep breaths and relax while I do the tipping. And you want to go 1 inch anterior and 3 inches superior, and always make sure that it never goes in more than 3.5 to 4 inches. Okay, hello again everybody. I will be doing a BE series of routine overheads. So I'm gonna make sure this tip is taped in place to my patient's leg, and she's in the Sims position from when I inserted it. So go ahead and turn on your right side. We're going to start with a right lateral decubitus. This is a total of about 8 images, so we'll start with right lateral decubitus. This is going to go right there. Seriously, why isn't it on?
I have no idea. I just watched it close. Turn it and then turn it back again.
Okay, sorry. We're good. So, the right lateral decubitus, the central ray is the iliac crest at the mid-sagittal plane, so it needs to go much lower. It's going to be a 14 by 17 sized IR. Her iliac crest is about here. So I can go significantly lower. You can see the light goes on the back wall at a certain point, so make sure that's not there. She's on her right side, the left side is up, so I'm going to use the left marker. Okay, I would use 120 at 20 for the technique here. Put your arms up by your head. Okay, I would go ahead and shoot that. So the next one is a lateral rectum. So for the lateral rectum, she's already on her right side. It's going to be the MCP at the as-is. I need to move this. Oh, I used a grid for the cross table lateral, and we just don't have a grid here. I would have also shielded, sorry. Okay. So for a girl, we would shield the breast area. So MCP is about right here, and at the level of the as-is, so that's about here. So we'll go a little bit higher. Okay, that's all lined up. 10 by 12 size, her right side is down, so I'll put the right marker here. I would do 120 at 60 because there's barium now, so it's a little harder to get through. 40 inch SAD. Okay, so now make it a little smaller. Okay, from here we're going to go into an RAO. So she's going to basically turn on her stomach. Okay. She's going to basically go on her, let me untangle you here. There you go. Okay, so you're going to turn just slightly at an oblique, facing towards me. There you go. A little like that. Okay. Okay, so for the RAO, you're going to put the central ray 1 to 2 inches towards the elevated side. So a little bit from the MSP, so not so medial. They're at a 35 to 45 degree angle, so it's kind of a shallow angle. And I would do 120 at 32 for this one, and it's still at the iliac crest, so we're still lined up there. The right, well, I'll put on the left side so it's anatomically correct. She has her shield. Okay, so from here we would just do the PA, so just lay flat on your belly now. Continue to shield. So we need to move it a little to center it up at the MSP, at the iliac crest. 14 by 17, put the left marker on her left side. So I would shoot that at about 120 at 30. Okay, from here we're going to do PA axial. So that's a 30 to 40 degrees quad angle. You're gonna want it to leave the as-is and enter the iliac crest, so right about there. You're gonna have to line this up again now since change the central ray. Left marker on the left side, shield on her. I would do 120 at 20 for this one, and this is looking mostly at the transverse colon and both flexures, so you could probably cone in a little bit shorter so it's not going so far down. Less dose to the patient. Okay, so from here we're going to go into an LAO, I believe, yeah, LAO. And so she's going to turn slightly away from me on her sides a little bit. Here we go, just, yeah, a little bit less if you can. So still at the iliac crest. Oh, we take the angle off, back to perpendicular. So still at the iliac crest. Fix this again. I would do 120 at 32 for this one. You want to have it 1 to 2 inches towards elevated side at the level of iliac crest. I would use the left marker on her left side. Shield. So I would go ahead and take that. Okay, so from here we're going to go into a left lateral decube. So I would get this thingy back, the grid. And before I make her move, I'll just get it all set up. So this would be a grid, and usually for the cross table, but like I said, we don't have one of those. Okay, go ahead and lay on your left side. Okay, so the same thing here. We're going to do 120 at 20, iliac crest at MSP. Lower it down a little bit, 14 by 17. Get nice and close to the IR for this one, and as close as you can, and kind of put your arm over the top if you can. Make sure our shield stays in place. Okay, that looks good. Iliac crest is here, so now her right side is up, so I'm going to use the right marker. And then that would complete the, I need to open this so it's more proper size. There we go. There's light on the table as well as above her. Make sure you got it. Okay, perfect. So from here, I would have my patient go use the restroom, and after that, I would take a post-evacuation picture. So that's PA, MSP at iliac crest, and I would do about 120 at 20 for that. And just make sure all the barium is properly removed from the colon. I will be doing the image evaluation for the BE. So we're using the book because we don't have overheads here. So you would start with the right lateral decubitus, and you would see the medial side of the ascending colon and the lateral side of the descending colon here. Sorry, these are all out of order, so bear with me. So here's the lateral rectum. For this, you're looking at the rectosigmoid area, which is all of this right here. That would be the sigmoid colon, and that would be the rectum. So the next one would be RAO, which is here. For that, you're going to be looking at the right colic flexure, which is right here, and the entire colon along with the ascending and the sigmoid. The next one would be PA, which is here. So this is just showing the entire colon, which you can see the ascending, transverse, and descending with the sigmoid right here. PA axial, that's this one. So that's going to be the rectosigmoid area is the main focus, which is all this right here. You want to have a 40-degree angle. So LAO would be next, which is here. For that, you're going to be looking at the left colic flexure mainly, which is right here. The entire colon along with the descending colon, which is here. Let's see, left lateral decubitus. Okay, here we go. That's going to be the lateral side of the ascending colon and the medial side of the descending colon. And then also we would do a scout and a post-evac, but that's not in the book.